Dr. Dieli-Conwright, who is a exercise specialist who will talk to us about exercise as medicine for breast cancer prevention. So thank you.
Thank you so much. Thank you for having me, and thank you all for tuning in today. I'm really thrilled to present Exercise as Medicine for Breast Cancer Prevention, a hard pill to swallow. And I think that in coming up with how to pitch and how to describe exercise, I want to acknowledge that it can actually be very challenging to perform exercise simply based off of time, life, other interference, barriers, etc. So I'm going to present mainly on more of the scientific evidence that we have to support physical activity and exercise as a preventive tool. And then later on in my talk, I'll also mention briefly just some things to consider personally when starting to exercise. So I always like to provide a terminology disclosure, if you will, that based off of what you read in the media and scientific literature around two terms, physical activity versus exercise. Exercise is a form of physical activity, but physical activity actually may not be referring to exercise. So oftentimes when you read epidemiology research, where there's large studies where data is collected over time, and then individuals are asked to report about their activity, that is then translated into some type of data to describe risk. And that is encompasses many types of activity that could include total quantified as collectively as recreational, occupational, transportation, household, etc. So really encompasses a very broad term. Exercise, on the other hand, is actually known to be a very motivated, goal set, rigorous type of movement based, where individuals seek out to achieve either weight loss or muscle strength, weight maintenance, etc. So I just like to clarify those. What we're going to be talking about here, and as you can see in these two tables here in the beginning, is physical activity, because I'm going to present some data from epidemiologic research that describes physical activity modalities or type, which you see on the left, and intensity, or how hard the exercise or how easy the exercise is, which you see on the right. So as I mentioned, there's recreational forms. So recreational forms of physical activity include exercise, maybe recreational or intramural sports, or in the sake of children, like after school activities, etc. Occupational would be any type of activity performed while at work. Transportation, based off of what you need to transport yourself. And then of course, household, which often we think of as including chores. And then recreational activity, again, just to reiterate, exercise, sports, and occupational, any physical activity at work. If you look on the right-hand side, intensity here, these are just some examples of intensity that are commonly used. Keep in mind that intensity, as we'll describe later on in the talk, can actually vary person to person based off of an individual's fitness when they're beginning an exercise program or when in the midst of an exercise program. But for example, vigorous exercise or physical activity is thought of as swimming, running, tennis, fast cycling, versus moderate, which is typically brisk walking, vacuuming, painting, mowing the lawn, or light activity, which is simply standing, slow walking, etc. Next slide. So there's a substantial amount of evidence to support that exercise lowers the risk of what we know as 7 common cancer types: colon, stomach, esophageal, bladder, kidney, endometrial, and what we're here to talk about today, breast cancer. Next slide. So before I go into the specific data related to breast cancer prevention, I thought it was important to very simply talk about why is exercise protective against cancer. And I know there's some features of this particular slide that are quite small, but if you focus in on the big picture of an untrained individual, which is on the left hand, the middle figure, which is people who acutely exercise, so maybe they do it sporadically, and then a trained individual, which is on the far right side of the figure. And simply put, individuals who are chronically trained might actually have metabolic features, immune system features, etc., that allow them to actually be healthier, that could prevent perhaps a tumor cell from progressing into actually cancer. Next slide. The other thing I like to also emphasize is while we are speaking about prevention today, I also think it's important to highlight that exercise can actually exert beneficial effects across the cancer continuum. So not only with prevention or detection on the far left of the slide, but if you follow the slide across the top in the black arrows, it can have beneficial effects during treatment and during survivorship and also palliative care. And this comes in the form of being able to if an individual has a higher level of fitness, they may be able to tolerate certain drugs that they're delivered during treatment of cancer better. There's some preliminary evidence in animal models to show that they might actually experience higher treatment efficacy, meaning that their treatments might work better if they are physically active. There's strong evidence to show that exercise during treatment can ameliorate adverse events or adverse effects of the treatment. And these types of effects hold true for during survivorship with late-term effects, potentially even prevention of relapse, and also during palliative care as far as promotion of treatment efficacy, preventing side effects, etc. Next slide. So what I'm going to focus on for the next few slides is actually data from the World Cancer Research Fund. And this is an organization that analyzes global research to really determine how physical activity and other lifestyle factors affect the risk of developing cancer. Next slide. So we know from a plethora of epidemiologic evidence that physical activity does lower the risk of breast cancer. And what you're seeing here on this figure is on the left-hand side, categories of strong evidence or limited evidence of where physical activity can actually decrease or increase risk. And if you draw your attention towards the middle row or the middle column there with decreased risk, you'll see that the second row down, there's actually strong evidence to support the decreased risk of postmenopausal breast cancer, as well as endometrial cancer. And then right below that as well, vigorous intensity physical activity decreases the risk of both premenopausal and postmenopausal breast cancer. So we're going to dig into this a little bit deeper. Next slide. So we know that total physical activity, so if you recall from a few slides ago, that would be basically any type of physical activity, recreational, occupational, transportation, etc., lowers the risk of postmenopausal breast cancer. And so if you simply draw your attention to this tiny red diamond that is towards the bottom of the middle of the figure, you'll see the cumulative evidence that supports that exercise or physical activity, reduces the risk. And we want that diamond to be on the left side of the number one. That demonstrates that there's a decreased risk. If we're on the opposite side of the number one, that would then promote an increased risk. And you'll see though that it's coming close into one, but that's simply based off of the way that the data is laid out here. And you can see that this is a handful of studies. Each of these are the authors of the studies that have reported this data. And again, this is epidemiological data that asks women what their physical activity patterns are before they're diagnosed, follows them over time, and then can compare women who actually are diagnosed with breast cancer versus those that are not. And so you can see here that there's about a 13% risk reduction in postmenopausal breast cancer in women who are physically active. Next slide. Specifically to a type of physical activity, recreational physical activity. So this would again be structured motivated exercise or some type of sports participation, lowers the risk again of postmenopausal breast cancer. And we also see this trend in premenopausal breast cancer as well. And again, if you look towards the bottom of the slide, there again is a small red diamond there. Many more studies here focused in, as you can see by the longer list, focused in on this particular type of physical activity. And again, it's about 13% risk reduction. So again, emphasizing this is specific to exercise and sports related activities. Next slide. So I thought it would be important to also bring in a recent example of a study. So this is, again, supporting that physical activity lowers the risk of breast cancer. And what this was a meta-analysis that looked at 38 different studies and brought them all together, similar to the previous slide that I showed. They had over 4.5 million women that they pooled together. And out of those, there were 116,000 women that were diagnosed with breast cancer. So they took those, all of the women, asked them the physical activity questions, and then compared the activity patterns of the 116,000 to those who did not. And what what they found was that it's quite a broad range, that there was a 12 to 29% reduction in breast cancer risk for individuals who participated in the highest level of physical activity compared to those participating in the lower levels of physical activity. And they quantified exercise by using what's called a metabolic equivalent. Metabolic equivalent is another way of describing intensity. And one metabolic equivalent, or one MET, is describes an individual's resting metabolic rate. So we all know that even just sitting here, our body is utilizing calories in order to sit here, to be awake, to be engaged in this presentation. And that equates to approximately 3.5 milliliters of oxygen consumed per kilogram of body weight. But ultimately what this is it's describing how much oxygen your body's using to stay awake and to be present, but while you're at rest, so while you're not actually moving. And what this particular study found is that individuals who participated in higher MET hours of activity had a decreased risk of breast cancer. And you'll see that in these two figures here. The left-hand figure is quantified in MET hours, which sounds a little bit clinical. So there's also the graph on the right-hand side that just breaks it down by straight hours per week. And you can see there's actually a dose response trend here, as we call it, where the more activity that an individual does, potentially the lower the risk of breast cancer. And you can see on the right-hand side, since we can all sort of think about how many hours per week we may or may not be exercising, that it's categorized by 0 to 5 hours. So the individuals who exercised 5 hours a week, which I will admit that I try to do, but may not due to many barriers in life, might experience that greater risk reduction in breast cancer. Next slide. So of course, we put this in the context of breast cancer prevention, but I also think it's important to highlight the other attributes of exercise that individuals may experience. Why is being active so good for us? And starting at the top and just going clockwise, there's some great cognitive benefits of exercise: reducing the risk of dementia and depression, reducing the risk of osteoarthritis, osteoporosis, osteopenia, etc. Of course, many psychosocial benefits: improving mood, reducing stress, reducing the risk of falls. It allows us to develop new skills if we decide to take on a new sport or a new type of activity where we can learn something. Boosts energy. Oftentimes people, while you're expending energy to be active, they actually feel more energized throughout the day or when they're finished exercising. Helps us maintain a healthy weight, which we know is very important for breast cancer prevention. It can be a socialization aspect, although we know that's often virtual now when exercising during the pandemic. Of course, reduce the risk of cancer. So I think it's great to highlight all of these, given that we all need to find our motivation for what keeps us exercising or what starts us on an exercise program. Next slide. So there are exercise recommendations available for cancer prevention. These are supported by a few organizations, and I'll provide the links to these at the end of the talk. This includes American Cancer Society, American College of Sports Medicine, American Society for Clinical Oncology, just to name a few. And really this comes from many research studies that have been conducted over the 25 plus years of what we call exercise oncology research and beyond, that has demonstrated better quality of life, less anxiety, depression, and fatigue, improve physical function, improve fitness, helping to maintain a healthy body weight, in addition to all the epidemiologic data that I mentioned that supports these risk reduction features. So here are the recommendations for cancer prevention. There is an intensity term here. So again, we'll talk about this in a few slides, but aerobic exercise is suggested to be performed at 150 to 30 minutes of moderate intensity per week. That can be broken up over multiple days, of course, because 300 minutes in one day would be quite excessive, or 75 to 150 minutes of vigorous intensity. So that would be the next level harder, if you will. So in essence, if you work out harder, then the recommendation drops to fewer minutes per week. And then also I like to mention that sedentary behavior is extremely important to limit nowadays. We're seeing more and more research as I'm sitting here and should be standing up while I'm speaking to you all. We all know that sitting for extended periods of time can also have a negative metabolic effect, negative effects on disease progression, et cetera. And there's more and more literature to support the negative attributes of sedentary behavior. So limiting activities such as sitting down, lying down, watching TV, or other screen-based activities are important to reduce. And then I always like to highlight resistance exercise. Resistance exercise commonly gets forgotten about. It's one of my favorite methods of exercise, particularly because it allows you to really strengthen your body. It allows you to use different types of equipment. But for those reasons, the latter, it's often challenging to do. It does often require equipment, although you can do resistance exercise with body weight. But it is, again, often forgot about simply because it typically requires knowledge of exercise technique, how to do certain resistance exercises safely, and then also some type of equipment or at least resources in order to get started. But it is a recommendation at approximately 2 days per week, highlighting major muscle groups throughout the body. Next slide. So I'd like to highlight, again, speaking of the difficulties of participating in exercise, a few points here just to put into light that we're all aware of challenges of participation in physical activity. So less than 5% of adults participate in 30 minutes of physical activity each day. Only 1 in 3 adults receive the recommended amount of physical activity each week. Only 35 to 44% of adults 75 years or older are physically active, and that number is even a bit lower in adults who are 65 to 74 years of age. And last point here, more than 80% of adults do not meet the guidelines for both aerobic and muscle strengthening activities. Hence the title of my talk, that exercise is not an easy pill to swallow. It can be challenging. It's difficult to fit in. It's not something that we can typically do in 1 or 2 minutes during the day and then be done and check it off of our list. We have to consider fitting it in, and especially in light of COVID, novel ways and unique ways, but these ways really depend on the individual person. And I'd like to share a little bit more about physical inactivity across the United States. So what you're actually seeing here is of course, the US map mapped out by physical inactivity rates. So the darker the red, the higher the physical inactivity. The green and the yellow, the less levels of physical inactivity in that particular region. So you can see on the left-hand side sort of how physical inactivity trends are spread across the United States. Not surprisingly, where there's obesity pandemic is even more heightened is in the deep south there, where you see the deep red with the higher rates of physical activity. I also think, interestingly, we should think about this by race as well, given that there are disparities, as we know, within cancer diagnoses, prognosis, and then other comorbid disease conditions. So you can see on the right-hand side of the figure, these physical inactivity trends broken up by non-Hispanic whites, Blacks, and then Hispanic whites. And you can see with Hispanic whites and Blacks, just simply by the level of the red and the orange that you see, there's much higher levels of physical inactivity among these racial groups than when compared to non-Hispanic whites. Next slide. So despite the regular health benefits of exercise that we've talked about, especially in regards to breast cancer prevention, we know that there are unique barriers that prevent regular exercise habits. And I've named 4 of the most common here: lack of time, huge barrier; lack of knowledge, lack of resources, and lack of fun. And with lack of fun, that's simply referring to individuals who just simply don't like exercise and don't think it's interesting to them, which is, of course, fully warranted opinion there. Next slide. So what I'd like to focus on the last remaining minutes of my talk are just a couple things to consider. These are not necessarily a regimen to follow, or not necessarily personalized advice, because I do think that is based off of a one-on-one basis, but just some things to think about, because regular exercise is possible, and by regular exercise, I mean staying on an exercise routine over time, really integrating it into one's lifestyle. It is possible, but with consideration of available resources to an individual and also personal preferences. And I think personal preferences is really key here, especially if you're an individual who just absolutely doesn't like exercise, finding a way to just stay active. As a personal example, my father actually hates going to the gym. My mother actually loves it. So his form of exercise is going swimming and walking the dog. And I think that's great, ways to integrate that in. So no matter how often I send him a Fitbit or how often I send him a TRX band or any other resources, he's not going to use it. He's just going to walk the dog and swim, and recently golf, and I will take those all as positive attributes. So first off, think about community resources. What safe, accessible community spaces are there? This is particularly challenging during the pandemic, but hopefully pre-pandemic and post-pandemic we'll be able to have opportunities to utilize parks and recreation centers, churches, and even schools that can sometimes provide free or very low cost exercise resources. Many of these, for example, is Recreation Center, and I know Nancy's speaking next, as well as the Zachem Center here at Dana-Farber actually have exercise classes virtually available. So those are great to keep an eye out for as well. But oftentimes people prefer to exercise outside and to get the fresh air and to be out. So thinking about safe ways to do that within, not only with COVID, but also within your own community are important. Next, it's important to think about healthcare resources or really incentivized programs that you might have at your disposal that you may not even know about. Oftentimes employers often offer discounted gym memberships or access to exercise apps, such as MyFitnessPal or Peloton, where you don't have to have the actual devices, but you can have access to virtual exercise classes. So those are good to look into if you haven't already. Individual preferences is huge. What drives your own motivation and your enjoyment? You yourself would need to identify what is the type of exercise that you want to do. What do you think is fun? What do you want to reap the benefits of? What will keep you motivated? People are motivated to exercise for various reasons. It could be physical appearance. It could be physical health. It could be mental health. It could be because their doctor told them to and they don't want to let their doctor down, which I think is a warranted reason. So really digging down deep and thinking about, what is your preference? What is going to motivate you? And try to find something that's very enjoyable. And then lastly, this might particularly be the trickiest one, is individual barriers. So what is the main barrier in your personal way of starting to exercise? Is it simply time, which is understandable, especially depending on caring for dependents, remote learning, which many of us are doing with our kids these days, and really trying to squeak in a little bit of time. While I mentioned earlier, exercise usually can't be accomplished in 1 or 2 minutes a day, starting with 5 minutes a day is an accomplishment. Second to time, boredom, trying to find something that's interesting, maybe joining a virtual exercise group, working out with a friend via FaceTime, etc. Things that can help to alleviate that. And then also keep in mind what resources you might have. Exercise ultimately doesn't have to require a lot of resources. Maybe a good pair of shoes so that you can take care of your feet if you're going to be walking or jogging or hiking, or good pair of shoes is pretty critical. But then you could simply walk and do body weight exercises. So not much equipment has to be involved. And then simply knowledge. So there's a lot of resources available. I'm happy to provide my email address, or there's other virtual resources available to start to really learn about what an individual should or needs to be doing. Next slide. So I just want to start finishing up by just mentioning some of these very common exercise guidelines that we talk about within exercise research and exercise prescription, as we call it. So the FIT principle is a basic principle that can help guide how to start and stay active. This describes frequency, intensity, type, and time. And I broke this down as a progression for beginner to advanced. And just for the interest of time, I'll focus in on the first gray column there, which sort of comprehensively buckets beginner and advanced together. So these are in line with the recommendations that I mentioned before, but these just describe some general parameters to think about. So frequency, exercising about 3 to 5 days per week is advised, starting at 3 and maybe progressing to 5. Intensity, moderate or vigorous, is both very beneficial. If you only have time to do moderate exercise or that feels more safe, it's a great start. Vigorous comes into play when you've been exercising for quite a long time and you really need to sort of push it to the next level. You're going to see more benefits if you progress up and do harder exercise. Type, aerobic and resistance exercise. I think we've talked about the benefits of those. Those are both very important to do, starting with walking and resistance bands, and then maybe progressing to actual free weights and jogging or hiking can be involved. And then lastly, time. The golden question is, how long should I be doing this? 20 to 60 minutes per session. 60 minutes actually sounds like quite a long time when you think about everything you have to fit in your day. So starting at maybe 10, 20 minutes, easing into it and just getting in what you can really do. Next slide. So in summary, we know that physical activity reduces the risk of 7 types of cancer, including breast cancer. Regular participation in exercise improves both physical and psychological health throughout the cancer care continuum. And we know that regular exercise participation can be guided by looking into individual barriers and then also relying on a general principle called the FIT principle in order to help sort of get us on the right track with exercise. And then last slide here, I'm always happy to take exercise related questions. So I provided my email here. I also, outside of the scope of this particular talk, I have a research lab at Dana-Farber. So I listed that there. It is focused on exercise. We have a number of trials for breast cancer survivors going on, or hopefully going on soon once we can exercise again safely at the Farber. And then I'd like to end with just 3 really nice websites here for more information on exercise for cancer prevention: American Cancer Society, cancer.net, which is supported by ASCO, and then the National Cancer Institute. And thank you so much for your time, and I'm happy to answer any questions in the chat.
Great. Thank you so much, Christine.